Hello everyone. Now we're going to review the steps for performing tracheostomy care, specifically cleaning the inner cannula. So to prepare, you're going to gather your supplies and then introduce yourself to your patient, identify the patient with two identifiers. You'll need a tracheostomy care kit, a bottle of normal sterile saline solution, sterile cotton swabs, and always grab an extra pair of sterile gloves. Also ensure self-care by proper body mechanics, position the patient correctly in semi-Fowlers, raise the bed, lower the bed rails to avoid leaning over. All important steps in preparation for trach care. So position your bedside table at the appropriate height. Make sure the table is clean and dry before preparing the sterile field. Position your patient in semi-Fowler's position and place a towel or absorbent pad over the patient's chest. So before donning sterile gloves, you're going to open your kit, take out the sterile field drape using the proper technique. So using sterile technique, being sure not to lean over or hit anything with your sterile drape, you're going to place it on the bedside table. After your sterile drape is prepped, empty the contents of the trach care kit onto the sterile field as shown here in the picture. Now you'll grab your cotton swabs and you'll open them on the sterile field, again using sterile technique, not hitting anything, dropping them onto the sterile field. So we're going to prepare our normal saline solution. We're going to pour them using sterile technique into the sterile saline solution containers. Next, you can start to hyperoxidate your patient before donning your sterile gloves. And as you've all practiced many times at this point, prepare your sterile glove package and don the sterile gloves as shown here. Again, once you have your gloves on, ensure that you don't touch anything else, and you are going to be sterile after this, so be sure you keep your hands at mid-level, not dropping below your waist or bringing above your chest area. Now that you're sterile, you can pick up your wire brush and the cotton swabs, place the brush in one of the sterile containers, and place the cotton swabs in one of the other ones. So now you can use your non-dominant hand and unlock and remove the inner cannula. Follow the direction of curvature as shown here. Place the cannula into the larger basin filled with the sterile saline with your wire brush. So here you're going to pick up the inner cannula with your non-sterile, non-dominant hand, and you're going to scrub it with the sterile nylon brush using your sterile hand. So once you've finished cleaning the inner cannula, you can drop the wire brush into the dirty container that has the saline solution where you initially dropped the cannula, and immerse the clean cannula into the container that has normal saline, the clean normal saline, and agitate it until it's rinsed thoroughly. So now you're ready to clean the tracheostomy stoma site, and you're going to clean under the faceplate with one of the cotton swab tip applicators. After it's been saturated in the normal saline, use a circular motion from the stoma site outward, and use each applicator only once and then discard it. So now you're going to clean the top surface of the faceplate with one cotton swab, and then the skin around it with with one cotton swab, and you swipe only once and then discard. Again, just showing here how you clean around the stoma under the faceplate, again using one applicator per area, and be sure to not recontaminate any clean areas. Again, just showing here in the pictures, cleaning under the bottom part of the faceplate using only one pass per cotton swab, and then you continue to clean around the stoma. And again, be sure not to recontaminate any of the clean areas. Once you're ready to reinsert the inner cannula, you want to tap it on the side of the container, being sure not to touch it with anything else. Make sure it is completely dry before reinserting it. Moisture can promote bacterial growth around the site, and it could also you want to make sure it's dry to prevent the patient from aspirating on any excess fluid when you reinsert the cannula. So at this point, when you're ready to reinsert the dry, cleaned inner cannula, you want to follow the direction of the curvature as shown here, then lock the inner cannula in place to prevent it from dislodging, and then reattach any oxygen source for the patient.